Good morning, everybody. It is 9 a.m. on Thursday, October 24th, 2024, and I'd like to thank everybody here in person and online for joining us for the Board of Directors meeting of the Animal Service Center of the Mesilla Valley meeting today. I would like to start by calling this meeting to order, and I ask that everybody join me in the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, and if we can, we'll start with a roll call. And if you can, we'll just start with Ms. Ward. If you can, announce your name and say you're present.
Present.
Jennifer Gates, present.
Becky Graham, present.
Becky Corin, present.
Joan Campbell, present.
Jess Williams, present.
And Commissioner Sanchez, I am present. Given those that are here in person, and we also have Commissioner Saldro Hernandez that is going to be joining us here in a second as he makes his way across the room. And so with that, we do have a quorum, and we'll move on to agenda item number 3, which is acceptance of the agenda. Before we do that, I'd like to just make sure, Clint, are there any changes to the agenda? Okay. So if I can get a motion, a second to approve the agenda as published.
Move to approve, Corin.
Second, Graham.
All right, we have a motion by Councilor Corn and a second by Vice Chair Graham. Are there any comments, questions? Not hearing or seeing any, so I will take a vote. All right, Ms. Ward, or actually, ex-officio member Ward, how do you vote?
Yes.
Thank you. Commissioner Saldro Hernandez?
Yes.
Member Gates?
Yes.
Councilor or Vice Chair Graham? Sorry. God,
Yes.
dang. I'm struggling this morning. Councilor Corn?
Yes.
Member Campbell?
Yes.
All right, Member Williams?
Yes.
And the chairman, myself, Sanchez, I vote yes. All right, so we have a agenda that is approved. All right, agenda item number 4.1, which is the approval of the minutes from the regular ASCMV meeting held on July 25th, 2024. If I can get a motion and a second for approval.
Motion to approve.
Second, Graham.
All right, we have a motion by Member Campbell and a second by Vice Chair Graham. Are there any concerns or any changes to the minutes that need to be noted? Okay, not hearing or seeing any. I'll start with the roll call. Ex-officio member Ward?
Yes.
Commissioner Saldro Hernandez?
Yes.
Member Gates?
Yes.
Vice Chair Graham?
Yes.
Councilor Corrin?
Abstain.
Thank you. Okay. Member Campbell?
Yes.
Member Williams?
Yes.
And the Chairman Sanchez, I vote yes. And with that, we have approval of the minutes from July 25th, 2024. All right, move on to our reports and presentations. We'll start with our Coalition for Pets and People presentation, which will be given by Dr. Don Duncan from the Animal Companions of Las Cruces. And I know Dr. Duncan is joining us remote, and so we're bringing up the PowerPoint presentation. And so, Dr. Duncan, can you hear us?
I can hear you, and I can see that the slides are up now, so that's great. Thank you.
Awesome. Well, I will turn it over to you.
All right. Thank you for inviting me to present to you today. As you may know, our nonprofit has now been operating for just over 2.5 years, and our mission and goals are quite different than most of the animal welfare groups operating in the county and whom we wholeheartedly support. Next slide, please. Let me just give you a few moments to take in our mission and goals. The only goal here that I would like to expand upon, since the rest of my presentation does not, is that last one. I'm not sure if you can actually see the last one. I can't see it there. But it is about advocacy. There we go. Advocate for methods to expand veterinary care. Thank you. We are advocating for the release of considerable state funds already set aside for spay neuter, including recommending one of our active volunteers to the committee of the New Mexico Board of Veterinary Medicine that's being constituted to disperse these funds. We're also advocating for the creation of vet tech licensing programs on our community colleges, supported by the state, as well as urging them to consider creating a veterinary school at New Mexico State, which already has a pre-vet. Competes has now made that unnecessary, at least until any court cases overturn it, at which point we are still poised to move forward. Next slide, please. Based on the Veterinary Accessibility Project, whose data partners are the American Veterinary Medical Association, Centers for Disease Control and Prevention, ESRI, and the United States Census Bureau, that score of 12 deems our veterinary care situation nearly inaccessible. Now, as to that second point, I'm sometimes told that Las Cruces cannot afford 24/7 care given our population. However, of similar sized cities that have 24/7 emergency care, 6 have a lower median income than Las Cruces. Now, with a total pet population of approximately 105,000 for over 81,000 households in the county, our populace averages 1.3 pets per household. And clearly, we all need help keeping our pets healthy. We know that all of our veterinary services are overwhelmed and need help expanding their staff, which is why a consortium approach of shared rotations will not work. We must work toward a standalone 24/7 emergency clinic. Now, I certainly don't need to tell this board about the correlation between intact animals and emergencies, but that correlation means that spay neuter are also a part of our medical concerns. We know that all of our veterinary professionals need the understanding and support of the surrounding community. Too often, especially on platforms like Nextdoor, all our veterinary professionals and shelter staff hear are complaints. We are determined to change those attitudes, and the support of our city and county can help. Next slide, please. To start our work, we asked the veterinary professionals what they wanted and needed in a meeting hosted in the Las Cruces City Council chambers 2.5 years ago. One of the first requests made of us was whether we could bring in a televet service to support the area. After research and interviews with the top services, we decided to bring in Vet Triage, an international service based mostly in the US and staffed by veterinarians who have their own clinics, but due to their concern about the crisis, agreed to give so many hours a month to Vet Triage. Clients set up an account for free, which can be done through our website or using the QR code on magnets we have made and hand out all around the county. Then, if a client is having a pet emergency, they log on for a video call or use the phone number provided and are connected to a veterinarian, usually within 5 minutes. Now, the televets can handle 60 to 80% of the emergencies called in. But if hands-on is needed, they will not charge the client. Rather, they will tell them where the nearest open emergency clinic is and have them go immediately. This service is also cutting down on the wait time in El Paso, which can be significant. One of our board members lost her dog there while she waited in the parking lot. The second ask was for 2 to 4 minute educational videos on the specific topics of spay neuter, infectious diseases and vaccines, heartworm, obesity, snake envenomation, and cannabis. We completed those professional videos with Dr. Sarah Wally as our spokesperson. She volunteered that time and expertise, and she did not identify with her clinic, but only with our nonprofit, so that all veterinary services would feel free to use these videos. We're planning 2 more videos, one on colic in horses and one on knee surgeries for dogs, both of which will likely be done by the voluntary work of the Schumacher team. For externs who come for 2 to 4 weeks, and 2 is usually the norm. We provide cost of travel, food, and housing. Now, we had an extremely successful externship this summer. The extern came from Washington State University, and I'm pleased to report that she has signed a contract with Zia Animal Clinic to take a full-time associate veterinarian position beginning in May. We've already had 2 requests from Texas A&M students for externships during summer 2025, and I'll talk about Florida in just a bit. The number one way to attract new veterinarians is to provide excellent externship experiences. So we are hoping that many more take advantage of such mentorships. Callista Animal Hospital, East Lowman, and Zia have all informed us they would like externs this summer, so the placements are beginning. Now, as I speak to you today, I am in Florida, where I've been recruiting at the University of Florida Veterinary Career Day. We're also recruiting over the next 2 weeks at Oregon State and Midwestern University, which is a branch of the university in Chicago, but their vet school is in Glendale, Arizona. The recruitment at Texas A&M continues to go well, and we also have plans to go to Colorado State and University of California, Davis in the new year. As always, we will have a booth at the AVMA National Convention. Now, the numbers we draw at vet schools are usually between 40 and 50. Here on Tuesday, 44 significant conversations with interested vet students. And at the AVMA, we usually draw over 200. We are getting notice, which can only help with recruitment. I can also report that we have worked hard to change attitudes here from complaint to support, and our community is responding. We currently have 415 active supporters. Our Facebook page, even though it's private and requires those joining to answer questions and be checked by us, boasts 1.2 thousand members. Our 2 former local mayors invited me to speak before the Las Cruces City Council and the Mesilla Board of Trustees. Mayor Ken helped me gather the veterinarians into council chambers by sending a letter on our behalf, and Mayor Nora attended our meetings and worked with me to set up a day where we brought in Zia Mobile Vet Clinic to do vaccinations while citizens registered their pets at City Hall and received educational information at our table. While our county commission, the Las Cruces City Council, and the Mesilla Board of Trustees have all expressed support, activating that support is something I would love to see. Mayor Enrique of Las Cruces has certainly given active support, helping us to take our annual fundraiser to new heights with his vision of what we could do. Our Paws, Claws, and Hooves fundraiser earned us over $10,000 in one night and will become an annual event. Now, all those funds go toward our mission and goals, especially the cost of recruitment trips, since every one of us work as volunteers, not a single paid person on staff. We continue to seek ways to collaborate across our community and to educate our public as we work to expand services and fulfill our mission. I'm working with the New Weekend Emergency Clinic, Pet Doctor 911, to see if we can expand eventually to nights and finally to 24/7. Last slide, please. As we think together about ways we might support your medical care of the animals brought to the shelter, these are a few ideas I have, but you may have more. We're already recruiting on your behalf on all of our trips. Now, you might be surprised at the number of students with whom I speak who are actually committed to shelter work when they finish their veterinary schooling. Yes, Tuesday, one of these who will be graduating in May specifically wants to be a shelter veterinarian. Now, I understand that being a veterinarian at a shelter often requires quite a bit of experience, as our vet has. But I also understand that that open job, it's been there a long time, it might be a real opportunity to take a graduate who has had a lot of spay and neuter experience already and train that person into the kind of vet you want him or her to be. Also, there were 3 second-year students I spoke with on Tuesday who want, when they graduate, if they don't change their minds, to also go into shelter work. and they would love to do a 2-week externship. If that is something that our shelter decides, yes, we can bring a person in for a 2-week externship, remember that we'll pay for everything. Also, what you would need to do, since the University of Florida works differently than all the other universities I work for, I would have to work with you. You would need to register with them to do an externship, but we could pretty easily do that. As for a MASH spay-neuter clinic, that will be a thorny problem that will have to be tackled by city and county, and you may have a role to play. One of the groups doing such clinics in northern New Mexico, Animal Balance, wants to come into Las Cruces to do such 3-day clinics, during which they can spay up to 200 animals with their medical team. Now, they've sent a memorandum of understanding with cost and expectations, but it's frankly too late now to get on their 2025 schedule, even if we could find a way to make such a collaboration work between our entities, including SNAP. We have the volunteers to help, but space, funding, and follow-up would need to be solved. The truth is we can't solve the spay-neuter problem here without solving the veterinary lack problem. That is why the work of Animal Companions of Las Cruces, what we're doing, is essential. Now, that's a lot to share with you in a very short time. So now I would like to open it to you for questions, discussion, if there is time, and that's the end of the slides. So thank you very much.
Thank you, Dr. Duncan. Vice Chair?
Hi, Dr. Duncan, thank you so much for your presentation. Just one quick aside, Dr. Wally is my family's veterinarian, so great to hear that she's involved. She is an absolute champion, so very cool. I wanted to comment specifically on the ongoing need. As you mentioned, we have expanded very slightly our emergency vet services that are available here in town, for which I am eternally grateful. And I like the idea, well, I don't like the idea, but I like that you pointed out that median household income is being presented as a barrier to expanding these services, when I think, if anything, it's much more of a barrier when families currently have to make the drive to El Paso, and usually at a really heartbreaking and stressful time, and not everyone has the transportation access to make that happen. So I think, if anything, median household income is perhaps a reason to advocate for more emergency service accessible here in town. And in terms of the working together, collaborating, I'm understanding more and more, as I've been a city councilor for a couple of years, how important the narrative is in getting things changed. And while we have to recognize the really intense challenges our community is facing, we also have to be able to put forth a narrative of what we're doing to improve things. And especially if we're working to recruit veterinarians who are in such high demand. I like the idea of showing, of course, we need to be cognizant of the negative, but also showing the positives of the community. It's very difficult to ask someone to move here if at the same time you're saying, like, oh, and the animal welfare scene is just awful. And again, totally recognizing our challenges, but also hoping that we can work together to frame a truthful narrative about the positivity of being in our community. And that's all I've got. Thank you so much.
I love what you just said, and I'm going to actually pick this up so I can let a 15-year-old dog out of this door here. So I want you to know, oh, we don't need the slides yet. I want you to know that when we go to recruit, and I know, Councilor Graham, that you've heard me speak when we began this whole process, but when we go to recruit, we take the job packet and the externship packet so they can look through it, and also show them online how to look through. But I'm selling Las Cruces when we go to recruit. I love Las Cruces. And as someone who was a professor for 29 years, one of the selling points I use is I tell them, look, when it's time for you to take a full-time position, do not just look at the salary being offered. Ask yourself what kind of quality of life you can have in that place. And then I show them the data. You know, I tell them, you know, like what my house cost when I bought it in 2019, unbelievable to me, considering, you know, I came down from being a professor in Minnesota, even though I'm from the Southwest. And then I show them the low taxes. But I also have a full picture book of just photos of Las Cruces in color. And I have our guide, and I talk about, you know, it's a university town, which I must live in, you know, that all these festivals and the microbreweries and the wineries, but that you can hike every day. You can afford to have a life here and raise a family here. And they get excited when they see those photos and they hear about the life I experience in Las Cruces. So I'm hopefully doing exactly what you are talking about.
Absolutely. And last thing, definitely tout that year-round outdoor activity. I actually ride mountain bikes with my veterinarian. So if you're looking to get in, if you see anybody with a bike, be like, hey, you can ride with a prominent local vet and an elected official. So we're a great selling point. Thank you. Thank you, Mr. Chair.
Thank you. All right. Any other questions or comments for Dr. Duncan? Well, Dr. Duncan, I just want to say that thank you for all of your advocacy. I know as you had presented to the county commission as well as the city council, this is something that you are passionate about, and I know as you know, I think we hear or we see, especially if you're on social media, it's hard to get away from the fact that we have a huge absence of emergency care and veterinarian care, and so that's something that we're still trying to solve. I know, just so we know, we don't think from the last meeting to now would wanted to at least let the board and the public know that the county did hire a veterinarian working for the county, and so we'll be working on, as she's getting up to date, we're working on getting our mobile clinic recertified. I don't know if we've finally got that done yet. Okay, no, but we're in the process of working through that, and so it's just, I know it's one piece of it, and it's not that it will solve the problem, but appreciate where you're going with it. I know I'm excited for the weekend care that we have here in Las Cruces that's now here, but as you had mentioned, hopefully we can continue to find ways to expand that. So I appreciate you taking the time to talk about, talk with us this morning, Dr. Duncan.
I want to just say one last thing that's not in the slides, and I keep thinking everybody knows, but you may not. Just know that any veterinarian that hires in, whether it's with the shelter, and I told our new county vet this, but she hasn't taken advantage yet. Mary Lou knows this. On top of whatever you all offer, on top of whatever the clinic offers, we add another $10,000 from animal companions because we want them here. So I just want you to know that. Okay?
Awesome.
So thank you. Thank you so very much for having me. I hope we can work together. Know that I appreciate and admire all that you all are doing. So thank you.
Thank you so much, Dr. Duncan. All right. Well, we'll move on to agenda item 5.2, the city and county ACO reports. I don't know if Mr. Halsey or Gino, which, all right. We'll start with the county ACO reports. Good morning, sir, and I appreciate you. I know, appreciate you sharing the districts, so we'll be able, I know everybody will be able to follow along when we get to the metrics piece, so thank you, sir.
Okay, so my name is Brian Halsey. I'm the caseworker for Donana County Animal Control, here to present the monthly report for July through September. Before I get into that, as Board Member Sanchez said, we have a new vet, and I'd like to bring her up to introduce herself really quick. She had something to say for the board as well.
And I apologize, I didn't see behind Officer Snow back there.
Yeah,
Good morning.
I was hiding. Good morning. Yeah, as a nanish as a tachi ni nishla, can la chini bashas chin, halt side na ada she chat lasha ada shanala. I'm Zoe McKenzie. I'm originally from Shiprock, New Mexico. And that was my introduction in Navajo. So any Navajos out there, they kind of know how we're related. And it's very important for us to introduce ourselves like that. So I'm originally from Shiprock, New Mexico. I'm a member of the Navajo Nation. And I started here at the beginning of August. And I've been working to get things together for the mobile spay neuter out in the unincorporated portions of Doña Ana County. A lot of policies and procedures, a lot of paperwork that needs to be done. So I'm hoping to actually get stuff going in January. That's my goal. I put together a plan. We've implemented the first parts of the plan, which is combining vaccination clinics with the ACEs. So we're able to increase the number of folks that are compliant with the laws for microchips and vaccine, specifically rabies vaccine, through that ACEs project. So we go out to the different towns with the animal control officers, and we provide those vaccines and microchips to the community members. The next one will be coming up in about a week. When we're going out to Chaparral. So we'll be out there for 3 days in about a week. Anything else? And, just really excited about, the host ended this meeting. Okay. Oh, okay, all right, cool, right on, all right. And I'm really excited about some of the other projects that, that Dr. Duncan was talking about it. We did talk about eventually partnering with different entities, to put on a MASH clinic. So that's one of our long-term goals. Yep. Anything else, Mary Lou? Oh, yeah, that's right.
Thank you, Dr. McKenzie. If you want to talk about our last Community of Hope event we did as well.
Okay, we did provide vaccines and microchips at the Community of Hope. That was another event that we did, and we also received a grant from Petco of vaccines. So we're pretty excited about that. Okay, thank you.
Thank you, Dr. McKenzie, and welcome. And I'm glad you were here to introduce yourself.
Okay. So these are going to be the numbers for July through September. I did go ahead and give you guys the map. So when it's our sheriff's map, but we go through the sheriffs for our districts. So that way when I break it down, you guys will have more of a map to look at when I do that. So for our reported strays, we had 856 reported stray animals. We were able to pick up 580 stray animals. Out of those stray animals, we were able to pick up 205 stray cats and 375 stray dogs. We had 58 sick or injured animals, 25 were cats and 33 were dogs. And we had 40 owner surrender animals. It was 2 cats and 38 dogs. This is our reported stray animal 4-year comparison for you guys. Just so you're aware, our July numbers were really high, but now that it's starting to get a little bit colder, it seems our numbers tend to go down every year. This is our 4-year field return to owner comparison. For July, we had 31. For August, we had 17. And for September, we had 21. These are additional animals that we picked up. We had 2 owner surrender cats, 38 owner surrender dogs. We had 58 sick or injured animals. We had 10 welfare hold animals. For those that are new on the board, a welfare hold animal is an animal if, let's say, our sheriff's unit, border patrol, anybody like that ends up pulling someone over or detaining someone and they have animals in their units. This is what the welfare holds are for. They call us and we go and pick them up for that. We had no neglect, abuse, or cruelty cases. We had 16 shelter quarantines, 4 home quarantines. For our court hold quarantines or cases, we had 19. Our live evidence currently held as of October 7th was 5. We have some of those that have been returned and some that are still in court hold proceedings. We had 3 rabies submissions. Out of those rabies submissions, we had 1 that did come back positive. That wasn't through our district as per se. It was a group that was helping with White Sands that had a bat that we submitted for them, and that was what that was for. We had 105 diverted intakes. We had 1,034 educational material and just education outreach. That does not include the fair. We were at the fair as well. We gave education out through there as well. And for our total calls, we had 2,136. So this is what I was requested for the map for last meeting. So these are our districts. So District 1, we had 1 cat and 15 dogs picked up for a total of 16. For District 2, we had 57 cats and 57 dogs for a total of 114. For District 3, we had 18 cats and 98 dogs. That was one of our bigger districts through these 3 months where we were very active in, and we had 116 total. For District 4, we had 41 cats and 70 dogs. That's usually one of our highest every month. District 5, we had 59 cats and 72 dogs for a total of 131. District 6, we had 9 cats and 13 dogs for a total of 22. And District 7, we had 20 cats and 50 dogs for a total of 70. So these are our stray cats picked up by district. Again, some of our districts you can see are usually high every month. For some reason, it seemed like some of our districts were a little more active than usual, especially in September. These are our stray dogs. And then our reasons for owner release, we had 5 that were involved in either vicious and or dangerous livestock. We had 11 that were aggressive. We had 3 where the owner was unable to keep them on the property, and they were going to end up receiving citations, so they just gave up the dogs. We had 5 that they were unable to afford or take care of. We had 2 that were either sick or injured. This was a new one that I haven't seen in a long time. We had 1 because they were barking. They just wanted to get rid of the dog. We had 12 where the owner passed away. And we had 1 that the animal was pregnant, and so they decided to give up the dog. And for that, I'll stand for any questions.
Thank you, Mr. Holsey. Mary Lou, I saw your mic on. Did you want to add anything? Or?
Yes, thank you, Chair. Just real quick, I just did want to remind the board that these are quarterly reports. They're not monthly like we used to, so some of you might be kind of shocked to see the numbers rise, where we're used to seeing these numbers a lot lower. So these are quarterly numbers. So this is going to be times 3 what we're normally used to seeing. So just wanted to remind the board with that. In addition, I wanted to emphasize on our new veterinarian that's here, who's also going out on our ACES project, because we just closed out a project in Santa Teresa. And because of our veterinarian on staff, initially we started in Santa Teresa with a total of, we went to 103 residents in Santa Teresa, door to door, making sure people were in compliance. We had 57 violations reported out of those areas. And upon our return, because we had the veterinarian with us and to assist us to help those animals get vaccinated, microchipped, and with the Clean Up with Carlos event, when the roll-offs come into that community as well, we ended up having 5 total violations upon our return. So that's a very big increase in compliance in that community. So the success is really, really great in that community as well. So we're really seeing those numbers turn around. So I just wanted to report that to the board.
Thank you. Okay. Are there any other comments, questions? I think the one that just kind of, aside, I mean, from the numbers, and I know, I didn't know if maybe some of that I assumed was partly because of the additional activity that had been going on between, in the different communities. If that was, or if it just seemed like it scattered across all the different areas.
I know the one that usually rises, it kind of flip-flops every year is District 3. That's like the Butterfield area, Amber Mesa, that area. For some reason, I don't know why, but it seems like we have a high increase in dogs and cats in that area, and then we become very active in that area, then it dies down,
Yeah.
and then it stays down for a little bit, and then it rises up again. That's the main one that I know of. And District 4, we're just always in District 4. That seems to be our big one for loose animals and everything. So that's the one that we hit, it seems like the hardest every month.
Okay. Well, I appreciate that. So if there are no other questions, I think we will thank you for your report, and we'll move on to the city ACO report. Gino.
Good morning, sir. How are you?
Wonderful. How are you doing, sir?
I'm all right. Board member, members of the board, my name is Gino Jimenez. I am, chairman. Board members of the board, my name is Gino Jimenez. I am the animal control supervisor for the city. I believe that my report is going to be a little different than the county's. I was given the instructions to keep it on a monthly basis. So what you'll see is my monthly report, but at the end, you'll see a running total for what's happened so far for this calendar year. It's going to be a little bit longer than typical. You know how our report used to be like 20 minutes, and I think I'm probably going to push 30. So with that, I will begin. So for the month of July, we responded to 432 calls for strays. Of those, 179 were GOA. GOA meaning gone on arrival. The officer had no contact with that animal. We were able to apprehend 253. 211 were impounded at the Animal Service Center. 105 were dogs. 106 were cats. We were successful in field RTOing 42 animals. Those were animals that had some sort of identification that we were able to give back to their owners, registered owners, and they never crossed the threshold of the Animal Service Center. 22 were unsuccessful. Again, those were animals that had some sort of identification. However, for some reason, we weren't able to give it back to them out in the field. So they ultimately had to go to the service center to redeem their animal. So we had a total of 64 identifiable animals for that month. Here is our graph for a 3-year comparison for July. You'll see that we did 432 for a running total of 2,980 reported strays so far that month. Our peak performance goal, number 1, is that we are able to secure 65% of our reported strays. That month, we were able to do 53% of our reported strays. Still working on these numbers. Here is our 3-year field RTO comparison. Again, we did 42, a running total of 278. Our peak performance goal is to be able to field RTO 25% of all identifiable strays. We reached a 17.5%. Here are the other 2 peak performance measures. Again, my peak performance measures are four measures. These numbers are reported up through my chain of command to City Council. I was asked to put this into our presentation because some weren't getting that information. So goal number 3, or measure number 3, is a 10% reduction in stray animal bites. We had a 21% decrease for July. Measure number 4, a 10% reduction in owner-victim bites, and we had a 14% increase in owner-victim bites. Moving on to the next graph is the community cat program graph. We were able to release 6 community cats. Those are cats that are identified by ear tip, microchip, they're spayed and neutered and vaccinated. but we had a total of 52 calls for service for cats in traps, bringing us to a total of 414 calls for service and a running total of 52 community cats that were released. Here is our reasons that we were able to field RTO for the month of July. 17, there was no contact by phone or at the residence. 1 was an out-of-town address. 4 chips were not updated, and 1 chip was not registered. Reasons for owner surrendering, 12 dogs were for aggression, 10 for the owner was unable to care for, 6 puppies the owner was unable to care for, 3 dogs were sick, and there was 1 euthanasia request. 3 dogs the landlord did not allow in their, on their property. 3 cats the landlord did not allow, and 1 was a dog for lifestyle changes. So that is our July. This is August. We responded to 473 calls for strays. 218 of those were GOA. 255 were apprehended, and 216 were actually taken to the Animal Service Center. 111 were dogs, and 105 were cats. We were successful in field RTOing 39. 22 were unsuccessful, giving us a total of 61 identifiable animals. Again, here is our running graph. 473 for the month of August, giving us a total of 3,453 for the year. Peak performance goal of 65%, as I mentioned before, we were able to obtain 61%. So we're getting closer to that 65% goal. 3-year field RTO comparison, again, 39 for the month, a running total of 317. A peak performance goal of 25% return to their owners, we were able to achieve 17.2%. The other 2 peak performance goals, a 10% reduction in strays, we had a 14% reduction in stray animal bites for the month of August. However, we had a 15% increase in the number of owner victim bites for that same time period. Community cat program, we responded to 56 cats and traps. We were able to release 7 of those were identified as community cats. And again, there's our running numbers, 470 calls for service, and 59 were released for the year. Reasons we're unable to field RTO, 16, there was no contact by phone or at the residence, and 7 chips were not updated. These are usually or typically our big numbers, reasons for owner releasing. And I know that if I did this on a quarterly basis, this number would be in the 80s, 90s, you know, as a total. And I can appreciate the way the county did their report. So multiply this times 3. 9 dogs, the owner was unable to care for. 8 kittens, unable to provide veterinary care. 4 dogs, the owner had their own health issues. 4 dogs for old age. 4 dogs for behavioral issues. 3 dogs, they kept escaping. The owner could not keep them on the property. 2 dogs keep fighting with the other pets. 2 dogs for aggression. 1 cat, the owner was going into hospice. Obviously could no longer care for that pet. 1 cat, because it continued to fight with the other pets. And 1 dog, the owner was unable to provide veterinary care for. So a highlight for the month of September, myself, Mary Lou, county representatives all met at the Department of Health, and we went over the emergency plan for the Animal Service Center. I don't know if that's going to be part of your presentation. I don't know. But that was a highlight for us for that month. Here are our September numbers, 440 reported strays that we responded to. 211 were GOA, 229 were apprehended. Of those, 106 were dogs and 75 were cats that were impounded at the Animal Service Center. 48 successful field RTOs, 21 unsuccessful, for a total of 69 identifiable animals. A 3-year field RTO comparison or stray dog comparison. And here again is our running number so far for the year. So for September, we responded to 440 calls, giving us a grand total of 3,893 calls for service for strays only. Of those, again, our peak performance goal is 65%. We were able to achieve 61. Again, that's probably our high number. We've only achieved that 65% once. So we try our best. Sometimes we get close. Our 3-year field RTO comparison, again, 48 for the month of September, grand total of 365. 25% is our goal. We achieved 17.2%. The other two peak performance, we had a 16.8% decrease in stray animal bites for the month of September, and we had an increase of 11% of owner victim bites. I believe that measure number 4 is probably our hardest. There's no way that we can control whether your dog is gonna bite you or not, or your cat is gonna bite you or not. Education would probably be the biggest thing there, how to recognize you're upsetting your cat or your dog, stay away, give them their space. We're not gonna find out about it till it already bites you. So that one is a responsive measure. The Community Cat Program. For September, we responded to 32 calls for service, and we were able to release 8 of those cats. Reasons we were unable to field RTO, 16, there was no contact by phone or at the residence. 1 was an address in the flats. And 5, the chips were not updated. Reasons for owner releasing, 9 dogs unable to care for, 7 dogs, the owner's health was declining, 4, the dog's behavioral issues, 3 dogs for aggression, and here's one to note, one of the dogs had bitten 6 family members. I kind of give this owner credit. They did their best to keep up with this dog and train it and find out what was triggering this dog to bite, and at some point they said, we can't anymore. So 3 dogs for bites, 2 dogs for old age, 1 dog killed another dog, 1 dog got too big for an elderly owner, 1 dog, the owner could not keep it in the apartment, and 1 cat, they could not afford vet care. Highlights for the month of September. So our chief of police came up with a great idea, and I don't know if it was the chief directly or Deputy Chief Urenda. I believe he takes credit for this. During fall break, excuse me, during fall break, we were trying to find things for the kids to do. We came in the middle of the month, and the chief said, you know what, we do an excellent job at promoting the PD to the public. But how are we promoting the PD to our own families? We have families out there, detectives, wives and children of detectives that know what dad does, but they don't know what traffic does. They don't know what patrol does. They don't know what all the other sections of the PD do. So we took this as an opportunity to educate our own. For 2 hours, we had a little field trip in the back parking lot of the East Mesa Public Safety Complex, where our families could come in and just mingle with us. It's a great way for our families to introduce themselves to each other, our wives, our children, our grandkids, to each other, and find out what we did as independent sections of the police department. The officers went through a 2-hour report writing update. The PD has also changed the format as to how we do our reports. It used to be where we would write a whole narrative. It could be 6, 7, 8 paragraphs of a specific incident, but now we've narrowed it down to specific bullet points. which is going to make the report writing process a lot quicker for the officers out in the field. And finally, each officer went through 12 hours of courtroom presentation and procedures. It's been a long time that we have done this. We felt the need. We were able to reach out to the city attorney, and with the help of the 2 new assistant city attorneys, presented 12 hours of training to our staff. This was codes and animal control. We've got some updates on some legal issues, some new laws that came through, and we were able to do mock trials. Each of the officers was required to stand in front of their peers and present a case from start to finish. And then we would sit and critique it, kindly critique it. So it was a learning experience for everybody, so very fortunate to have that. So our monthly calls for service. For July, we responded to 1,205 calls. August, 1,090. September, 1,040, bringing us to a grand total so far of 10,186 calls for service. And with that, I will stand for any questions.
Thank you. Any questions? Yes, Member Gates.
So I was just wondering, so since we're noticing there's an increase in the owner-victim dog bites, if maybe you could provide some insight on what the outcomes of some of those situations are, like if it generally results in a surrender, a citation, or counseling sort of with the owner, what the outcomes usually are for those.
Absolutely. I can tell you this. Let me write that down so I don't forget it. The majority of our owner-victim bites, those animals are going to stay home. We're going to do a home quarantine on those animals, and then life goes back to normal. It's very rare, except for the one example that I gave earlier, that owner releases a bite to us. They may do it after the quarantine period is over directly to the Animal Service Center, but it's very rare that they owner release it to us for that reason.
Thank you. Are there any other questions, comments? All right. Gino, thank you so much.
You're welcome. Thank you.
All right, agenda item 5.3, which is the Executive Director Report or Shelter Statistics and Activities. Mr. Thacker.
Good morning, Mr. Chair, ASCMV Board. Thank you for having us here. First, before I start, I would like to introduce one of our new employees. This is a brand new position we've had at the center. We're so excited to have Carol on. It's Carol Nielsen. She is last from Utah, so we've had some great discussions of who, what, where, and how. We're not related in any way, so it's all right. But I want to turn some time over to her so she can share some of our future plans that she has for the ASCMV, some changes she's already made, which have been great on social media. So Carol, of yours.
Thank you. As you mentioned, I'm Carol Nilsson. A little background on me, I got my bachelor's from NMSU in journalism and mass communications. Spent a little time in Utah, but I'm originally from New Mexico. And since I have been at ASCMV, I've been there since about mid-August. So I've spent a little time assessing, but then a lot of it was kind of just getting up and running with it. So my priority at the beginning was working on branding consistency, especially as we're looking across the digital platforms we're currently functioning on. So working on branding, because that's pretty easy to target at first. And then simultaneously looking to see kind of how effective our different platforms are at reaching the public and kind of what the intended purpose is. And that right now we're going through some discussions on what we've done in the past, what's the correct medium for things to be communicated. And so currently our biggest discussion has been around, we've been posting daily stats on Facebook for several years now. And I did some independent research to find that it's not really a common practice to post daily stats. And also the concern on my part was is this creating effective dialogue with the community? Is it helping the community really understand the context of what we're doing day to day? Because most people don't have data training, so it's really hard to look at raw numbers and really draw conclusions that really reflect the work that's going on day to day. And so we're in the process of transitioning the data to a monthly basis so that we have time to validate the data. So there's an emphasis in accuracy, and also transitioning it to our website, because another issue with posting it to social media is that it gets lost in the shuffle, so it's hard to do comparative analysis. And then also, depending on when it gets posted, it might drown out the other good things that we're doing at the shelter and trying to promote. So we just have to be really mindful about how we're utilizing social media so that we can really use it as a platform to promote, educate, and just increase the community knowledge, and also hopefully build a bridge of communication. And so for the data being on the website, it will make it generally more accessible for the public. And then in the monthly format, like I mentioned, we'll make it easier to make sure that we're validating it, and that accuracy will be there. And it will also be easier for the public to go back and reference. They can do a little bit of comparative analysis if that's something they're interested in. There has been a little bit of public concern that there is going to be a decrease in transparency, but Clint and I have talked pretty extensively about how we maintain that transparency while also helping build context, because again, it can be hard for people to kind of understand raw numbers and what that means for the overall system and the work that's being done. And apart from that, what else? I just remembered. So, and then formerly, we had been doing a podcast. And so we've been in discussions if that is the right method, because we do want to interface with the public and really increase accessibility. But we do have to consider staffing capability and time. And this is a great position. I can't be everywhere all at once. And so it can be hard to really do everything yourself. And so we're hoping to be able to take a strategic approach and tap into mediums that already exist and work with community partners that may have a broader reach within the community, and really let them do that piece to broadcast it for us, and make ourselves accessible for the messaging, and make sure that that's something that we're doing regularly. So we're in the works of talking if the podcast is the best format in which to do that, or if we can lean into some media partners to interface with the public a little bit more. Any questions for me?
Board Member Williams, please.
Thank you. One of the things that concerns me about getting away from doing reporting on social media is the appearance of the lack of transparency. People aren't going to go looking for the website. We know that. We know that they signed up for Facebook because it was easy. So while I'm not criticizing your strategy, I do hope that there is going to be a consistent effort across your social media platforms to drive people to the website and to tell them why it's important for them to link to it on a regular basis. If you don't want to put the raw numbers on Facebook on a daily basis, I can understand why. But I do think that in order to avoid the ding, we need to make sure that we're linking to that website on a regular basis and telling people what's there and why it's in their best interest, if they care about the animals of the community, to visit it regularly. Thank you, Mr. Chair.
Absolutely. If I can
Yes,
respond
absolutely,
to that, because that is a part of the plan, to make sure that we're emphasizing and posting when the data gets posted to the website, because part of it is, it also poses the potential to drive more traffic to the website to kind of see more things. And there are ways that we can strategically make sure that we're keeping consistent links in our link tree, so that it's not just accessible on Facebook, that anyone who's accessing our link tree from Instagram or TikTok, that they can also find that link, and making sure we're doing the due diligence on social media to let them know that they can go there. So excellent point.
Thank you, Board Member Williams. Board Member Gates.
Just want to note too, there it seems there has been some updates on the website. So if anybody hasn't noticed that, go there. It looks like you're working through getting that stuff posted, like whatever services and just detailed information about volunteers. So, you know, there is a reason to visit the website, and I appreciate that because I think one of the things is when you keep going to the website and it's the same information and it doesn't look like anything has been updated or changed in any way, I think your people are less likely to use that as a resource. So I think I appreciate the direction that you already are taking. So good job.
Thank you.
Thank you. Any other comments, questions? And I'll just add, I think one of the things that I think I appreciate with, and I completely understand, I think with the concern of posting them daily, I think what ends up happening sometimes too is definitely you start seeing it on your timeline and people start scrolling past it on on the Facebook, because if they're concerned, they go and look, others won't, and so I'd be curious to kind of see how this evolves and so forth, because I think it is important with some of the efforts that the ASCMV, that Clint has made with trying to coordinate with the different advocates in the community, bringing them in, trying to show that level of transparency. And so I think it's an important step that understanding why the metrics are there and then trying to continue on to show that level of transparency, I think, as Board Member Williams had stated. So I'll be curious to see how we continue to evolve. And I appreciate the Board Member Gates for pointing out the changes to the website as well. So hopefully people will go click and take a look. So thank you so much for your efforts and welcome to the team.
Thank you. Have a good one.
So again, just for the record, Quint Thacker, Executive Director of the Animal Service Center. We are going to be presenting to you our numbers in a quarterly basis. So when you look through these are going to be much higher than what has historically been done. Since 2008, we've been doing monthly meetings. So I just want to point out that these are now quarterly and going forward. This is the actual animal count at the current center right now as of yesterday. Currently 395 total animals. As you see, that's down from 22 and 23. So this is a comparison chart for intake. We had a total of 2,472 animals come into the center in the time frame of July through September, third quarter. This is how those animals came in. As you can see, our highest, as is going to be, is the strays by animal control officers at 53%. The next one, though, is the strays by the public. These are animals that the public has found, brought into us. They can't hold on to them and try to find the owner. We always ask them to. But if they can't, then they come into the center, and that was at 22%. But right behind that is that owner surrender, and that's the number we are always watching, and every single time I look at that, it just amazes me how high that is. 18% of our intake comes from owner surrenders. This is a year-to-date number, looking at comparing through the years between 22 and 23 and 24. So this is our returns. We had 26 total. You can see the reasons there. As usual, while you're reviewing that, just want to point out, we always ask the individuals if they would like to do any training. They get a free counseling with their adoption that they can do. It's teleconferencing or telebehavior, guess you could call it, but they get that free through some of our programs. And then we also have the Doña Ana County Humane Society has a program where they'll have somebody come out to your home and do that as well for free. So we always present those. We always give them tips. We have paperwork that we could give them, but sometimes they just can't. They got to return them. So you can see there the reasons why, for 19 dogs and 7 cats for the last quarter. Diverted intakes, I had a good conversation. As you see, in July, it was 307, then it just dropped like a rock to 191. Diverted intakes is just like I said before, somebody comes in with an animal, whether it be a stray or it be a owner surrender, what they like to do, then we talk to them and say, hey, can you hold on to the stray animal, go for a walk, knock on doors? If they say yes, it's a diverted intake. Maybe they said that we can't afford food, we need to turn the animal over to you. Well, here's some food, get you through until payday. Would that be okay? They say yes. So these are all diverted intakes. So you see the huge drop. And what I had a conversation with our office manager is that we've seen a significant decrease this summer from July into August, September of kittens. Kitten litters are an extremely high amount of work. They have to be fed every 2 to 3 hours. You usually have a kitten litter of 4 to 5 kittens. As you can imagine, that puts a toll on somebody. So when we tell them, somebody comes in with kittens, and we say, you're gonna be up every 2 hours, and you have to feed them, and you have to wipe their bums with a wet rag, and then you have to clean up after them, and you have to keep them warm. It's a lot of work, so they're like, I just can't do it, I'm sorry. So we get multiples of 3 and 5, we get these kittens coming in, but that has gone down, as you see in August and September, and that's the only thing that we can think of the significant decrease in the diverted intakes, is that less kittens coming in, so that'd be lower number, less kitten litters. We have them coming in, don't worry, but the litters that it takes to have to find fosters for and try to divert those are gone. So while it's good that we don't have the high numbers coming in, but it also shows that we're doing less diverted intakes. So our outcomes, this is how those animals that came in, we saw at the beginning, this is how they left. 23% left via adoptions, which is a fantastic number, especially you see compared there to last year. We're up almost 4%. The rescued, as always, our rescue community and also our rescue coordinators do amazing work. Almost 24% of our animals left alive through rescues. Our euthanasia is the highest at 27.4%. That still leaves us with a 71.6% live release rate. That means that animals that left the center alive, 71.6%. So this is our year to date. The last one was just the quarter, and this is what we're looking at with the big picture overall, 69.6%. So we're higher than we were in 23. Remind you that 2022 was just when we were starting to creep back up into numbers. But it's a pretty high, the total number that we have coming in, but still our rescues are doing really well. They're right on path of where we were in 23, and our euthanasia continues to be in line there as well, unfortunately. This is a list of quarterly of our rescues that have participated. We have some awesome individuals that help. Rebel Angel All Breed Rescue is a local one here. They do a lot of work with us. Halo is one that is in Phoenix. They're out of the area, so we do transports to them. They do fantastic work with us. Another Cruise Crusaders does, it's just amazing all across the board. We are working really hard with a lot of rescues to take these animals. So thank you to all of them. Here's our euthanasia reasons. Number one reason for dogs is the behavior space. And what I mean by that is we would not be looking at these animals for euthanasia if we had the space to keep them. So the only reason why we're looking at them is because they have behavior issues and what we need the space to bring in. There's some confusion on Facebook and all social media. There's questions of you have the Great Big Center and you have this also the medical center. Both buildings are full. And we have a continual intake. This is one reason why I liked the daily numbers, because it showed the continual daily intake on average of 17 animals per day coming in. So if we're full, that means we have to make room for up to 17 on average. Some days are 42. 42 animals come in, and we have to make room. So it's a constant revolving door where we got to make those room for the animals. For cats, the number one reason is ringworm. Before, or when we had the space, we were treating ringworm. And right now, it's contagious. We do send them out to rescue as much as possible, but we have to euthanize ringworm right now because of the lack of availability for space. Because once you have ringworm in an area, it's not like you can just put animals in there afterwards. It turns into a dedicated space because it is contagious for other animals to get. Our surgeries continue to do amazing work. Last quarter, they did over almost 1,400, so 1,310 surgeries. You see the breakdown there. Down just a little bit, 20 surgeries is all from their last, or from August to September. So they do amazing work there. Over 3,350 total surgeries for 2024. Our fosters continue to do amazing work. Really, the foster program is where we can really make a difference with the numbers in our shelters. Like I said, that revolving door, always having to have animals coming out. Fosters is a live outcome. So people can take a foster, come and get any animal they want. Whether it doesn't have to be in trouble, it doesn't have to be injured or sick. You can come and foster an animal, and we'll give you everything for it, food and supplies. Then they can hold on to that animal. They bring it to adoption events. They can get it adopted on their own, so on. And it is a huge help for the center, and it saves lives. Our volunteers continue to do amazing work. We are currently doing and pushing really hard our play groups. If you have never seen a play group in action, I highly suggest you come and see these play groups and how they work. And what it sounds like is we just get a bunch of dogs in a play yard and they just have fun. It's not that. We get, in an organized manner, dogs continually to come in and come out of the play group. So dogs are always rotating through. We have 2 individuals in the play yard at all times to watch. And they watch every single dog that goes in. And if they can tell the dog is being stressed, they can take him out. If they can tell the dog is playing too hard, they take him out. They let things happen. Communication, dogs can't say, hey, you're bugging me. It's usually with a growl or a nip. And they let it happen. They see the signs of when things are going to go too far. To date, we've only had probably 2 or 3 animal issues or dog issues that are in the play yards. And when you're talking 20, 15 dogs in a yard, that's really good. And it's happening 3 times a week for, I think they go for 4 hours. So I highly, highly recommend the board come out and sees these play groups. They're so awesome. As you can see, over 1,800 total volunteer hours for the 3rd quarter.
Mr. Chair.
Yes, Board Member Williams.
Just going back to that for a moment, Clint, I would like to come and look, but I don't see, when is it happening?
It's a secret. We don't tell people.
It makes it harder for me to watch.
Saturdays and Sundays, and was it Tuesday or Wednesday?
Can
I
you
can get you the for sure time.
Can you send us a schedule to
Absolutely.
all of us? Thank you.
Yeah, and some start in the morning, some days start in the afternoon. And people are just walking through the center, and they sit and they can watch these play groups happen because they're outside. And it's really neat to watch. So yeah, I'll get that out to the board schedule there.
Thank you, sir.
Our visitors, you can see we are above, a little bit higher. Looks like 1,700 people coming into the center. So that's awesome. So the next few slides they're monthly, so we have July, August, and September. Okay, can you see my pointer?
Yes.
All right. So this is the Facebook visits that we've had on social media and the Instagram. Now, these directly impact in ways the web views and the new users. So web views is our website, you'll see, and the new users are unique cookies that what they're supposed to be is a unique visitor. But I could visit on this computer, and then I could visit on my handheld, on my phone, and it would see as different cookies, so it would count me. So it's not an exact count of the users, but it does give an idea of new visits that may be happening. So that's a pretty awesome number we have there, 5.3 thousand new users coming in to the website there. So this is when we started to do some impression ads through Facebook. And as you can see, the clicks to the website, we had 320 clicks just going to the website from these fun little quick Facebook ads that we do on Facebook. They're just really quick, hey, adopt, and that's all it is, and you click on it, it takes us to the website. So they're a great tool. We had a 60% increase in our Facebook visits in the month of August, and I don't think that's any coincidence. That's when we started having a digital content specialist, was mid-August. So she's done an incredible job increasing those. 189% increase in Instagram visits. So we were finally able to link up the two. I believe it was in August she was able to do that, and we saw a huge increase in that. And again, 5.5% or 5.5 thousand individuals were new to our website. I see here again, you can see 5.1% were new original users to the website in September. Some of our events coming up, PetSmart, the dispensary, and Petco adoptions. The Petco is always a good draw that we get there. They're on Friday, Saturday, Sunday. So we urge everybody to come out and visit the adoptable animals that we have there. In November, coming up, we're excited. The Elks Lodge one is going to be really neat. We already are making good strides to update and to get fun things happening there. Picnic with a Pup is at the center, so we try to promote that as much as possible. We're going to have food trucks. You can come out, you can visit, be with the animals. We'll have some out in crates and then you can go and visit all the others, and there's also going to be play yards available so you can have the animals out. It'll be a lot of fun. This is Dog of the Week. Remember, the adoption's free, so I encourage you to come out and see Capri. And then our Cat of the Week was adopted, I think on day 1. So we're excited to see that. We have so many cats right now up for adoption. I encourage all to come out and see in our beautiful new center these amazing animals that are there. And that's my presentation. Any questions?
All right. Board Member Gates, please.
Not really a question, but I just want to give a shout out to the cat people of Las Cruces, because I think the decrease in kitten intakes has a lot to do with a lot of the organizations that have been taking them in, as well as all the TNR orgs that have been working on getting our community cats spayed and neutered. So just wanted to point that out, that there's a lot of work being done at these small organizations that have done a lot of volume when it comes to kittens. So thank you, cat people.
Thank you. Board Member Williams.
Mr. Chair, first off, if I appear to be grimacing and making faces at you, it's because my back is out, and every time I move in a certain way, I'm going to make a face. Gino mentioned something in his presentation that I want to circle back to, which is that you had a session at the Office of Emergency Management to talk about an emergency plan for the ASCMV. I would like to see a presentation about that at our next meeting, about what the bare bones of it, what does that plan look like, who would be involved in executing it. I just think that what we just saw in Roswell indicates the importance of having a plan like that in place. And I'd like to know more about that training.
Okay, and the reason why we didn't bring it up, and yes, I completely agree, Mr. Williams, it's not finalized. There's some parts in it that still need work, but we've been aggressive in doing it for the past probably 3 months. Thanks to the big driver of it was Barbara Bencomo with the city. When we had that power outage during the heat, and she asked me if we had an emergency plan, and I said, other than the state fairgrounds, no. We've never been able to be a part of that. So she circled the horses, the wagons, everything, and got us part of the emergency, the name of it just left me.
Emergency management?
Yes, Emergency Management Center. Using their resources, we have an awesome plan. So yeah, once finalized, for sure we can get it to you and get a presentation in January.
Thank you, Mr. Chairman. Thank you, Clint.
Thank you, Board Member Williams. And I'll put in, I think as you mentioned, Clint, I know with the OEM, I think one of the things that Mr. Lopez there, as well as his deputy, I know he's been our interim deputy director of the OEM, Amanda Bowen, they've been working, especially because of what we're learning through all these events in Ruidoso, in Roswell, and so on, that, they had been working on trying to make sure they had action plans for all these different organizations, and it was a perfect opportunity to make sure the ASCMV was included, so that was an area that we didn't have any blind spots with, so I appreciate it. Yeah, and I'd look forward to see it'd be nice to know what that plan is, and maybe by the next meeting, that'll be closer to being adopted, so thank you. All right, any other questions, board members? Commissioner, I don't know, I see you're trying to hit, Commissioner Salazar-Hernandez, did you have comments or a question?
I just grimace every day, but.
And I apologize, I saw you hitting the button, I didn't know if you were trying to hit the microphone or hitting another button.
Clint, can you do me a favor, and can you go back to, on the slides, can you go to deferred intake for me? Perfect. Oh. Awesome, thank you. So with this, you kind of talked about providing dog food to help get them to where they need to, maybe the classes that we offer, connecting them to those kind of resources. So what is our policy on diverted intake through the animal services shelter? What is our policy on that? How does that work? We're giving them resources, but what is our policy exactly on that?
So we don't have a written policy on diverted intakes. It's more like a SOP of what we follow. Front office is supposed to do all they can not to have the animal cross the threshold into the center.
Okay. So we have an SOP on that, or?
I'd call it, it's a written down.
That's a policy, I would say.
Yeah, okay. Yeah, you have a policy then.
That's definitely a policy. So I just wanted to bring this up, and I know that I think we've touched on it before, prior meetings, about not turning away people that are trying to owner surrender. And I was hoping that you could touch on that a little bit. I know as a commissioner, I've gotten a few emails in regards to that. And I just wanted to see if we've kind of stopped that practice or how we're helping those people that are trying to owner surrender.
Thank you very much, Commissioner, and I'll do my best. So how it works is somebody comes in, like I said, the individual, our staff does all they can to keep that animal from coming across. If the person says, I cannot do these things, I've reached out, I've done this, then we take the animal. There's no question about it. We do not, if the person says, you know what, I'm just gonna go dump it in the desert, say, no, don't, we'll take the animal. We have had some weird things occur, like Gino's called me a few times and said, there's somebody calling saying that I need to come pick up an animal at the ASCMV because you guys are refusing. And every time it's always a misunderstanding. Like we give them a piece of paper that says we ask or request that you contact these rescues before bringing the animal to us. And what they interpret that as is you have to call these people before we'll even consider taking your animal. And it's not the case. What we're trying to do is divert, have those animals not come in. I mean, like we said, when we're full, like we are, that's an animal coming in means death for another animal that is there at the center. So we have never flat out rejected somebody's animals. A municipal shelter, we can't do that. We do request that they do certain things before we take the animal, but we will take the animal in the end.
All right, thank you for that explanation. I think that kind of gives us a little bit more understanding of the framework. Something that I would definitely ask and request of you to kind of look at is maybe giving them a place to sit in the lobby, give them an animal services phone to have them maybe call those numbers, just giving them those resources of, you know what, take a minute, let's work through this list together. Your staff would definitely know best practices of who might be willing to assist in this, who might be willing to take that animal through those shelter lists, and maybe working through that. I understand that that's more of a burden on you and your staff, but also if it does kind of divert those intakes to other shelters and they can be that middleman to like, hey, meet us in Deming or something like that, I would definitely say that's a win in your book as well as in our book. But you know, at the same token, I can definitely see giving them a paper like, hey, we request that you call these numbers, might be seen as a no, right? I mean, it's definitely a process. You're doing everything in your power to make sure that you're giving them the resources and everything like that. And, you know, a lot of people don't have the social emotional skills to be able to tell you, no, I'm not going to call these numbers or something like that. And yeah, then they would definitely go out there and drop the litter of kittens in a pecan orchard or something, and that's not what we want as well. So maybe looking at that policy, maybe working with the board and saying, you know, what are best practices which you and your staff would know, but also kind of working on that policy to actually make sure that it is a policy that you all are following. And kind of going through that step. You know, I do know that you guys have the cages outside to drop overnight and stuff like that, but
No,
they're gone now?
we
They've been gone, okay.
haven't had those ever since I've been here.
Okay,
Yeah.
perfect. So just making sure that we're turning away people and we're giving them the resources. You know, dog food is great, but that only gets them by a little while. So definitely working on those resources of what we can do inside. And we have a nice, beautiful, big lobby. We have benches outside. Let's try to help them and assist them if it's making a phone call or whatever it is, just doing that.
Okay.
Okay.
I think it's an excellent way to address it with staff as well, is let's be human and look at that. I also want to say that if any of you have, from your constituents or from fellow citizens, receive complaints like that, email it to me or call me and let me know, and we can get to the bottom of it. Like I said, probably 9.8 out of 10 is a misunderstanding of what was being said. So we can clear that up. Thank you.
Board Member Williams?
Mr. Chairman, just to build on what Board Member Shaljo Hernandez said, there's got to be other shelters out there that are going through this, that have the SOPs and that have the policies written down. And I know that you're very well networked, Clint, with the other shelter directors. And I would just suggest that as time permits, to reach out to them and maybe get, you know, we probably don't have to reinvent the wheel on this. So I think it's an excellent suggestion that the other board member made, and that we can build on that. Thank you.
Thank you.
Thank you. Are there any other questions from the board? I did, and I don't know, and I just wanted to bring this up because I know, Clint, I'd reached out to you, and I understand that Dr. Haddon and the staff are doing an amazing job with over 400 spay and neuters this month, and I know you're doing community cats, I know you're doing SNAP. I don't know if there's, you know, I had a constituent this month, and it wasn't the first time, where they were concerned at the fact that they were turned away from the ASCMV because they had some animals that were brought to their home, their farm, and they were willing to pay, they said they were willing to pay, and so, you know, but because they were trying to get them accommodated at the ASCMV, they got directed to SNAP, and they said they knew they were not going to qualify for SNAP, especially given their income levels. And so the question is that I don't know if we may want to, I know we're actively looking for another veterinarian. I know that position's open. I know we can have a discussion about that piece of it. But I didn't know if in the meantime, if there's ever an opportunity that maybe we look at if there are members of the public that were willing to pay full price for a procedure, that we set aside so many slots, potentially a month, or a week or something, and, you know, that way they don't necessarily always have to go to a private vet and have to pay for the wellness check and then doing this, especially for rescues or so on. I know it's not by any means going to significantly increase the revenue of the Animal Service Center, but, you know, I think if you charge at least $100 or a little more, you know, and you did, you know, that does add up and could potentially offset some of the additional costs that we have. And like I said, it just, I don't know, and maybe it's something for discussion in a future item to discuss as policy, but I just feel like when you have people that are willing to take in a rescue and doing that, but then again, they're trying to find an easier way to get them sterilized and fixed, or, you know, there might be an easier way. Commissioner?
Just to build off of that, because I definitely understand where you're coming from on that, and maybe that's something we can work with Animal Companions to maybe put some of that funding that they've already received to good use, but also if we can look at it maybe as an incentivizing the veterinary staff that are there, and incentivizing like that practice more so to kind of create, whether it's a educational payback program or something like that based off of those full service paid programs, that might help incentivize getting more veterinarian interest in that position that's open. So maybe that's something that we can look at with City of Las Cruces HR to see if that's a possibility, but it would definitely make that position more attractive to doing other kind of services, maybe with that incentive of education payback.
Okay.
Just a thought.
I appreciate that. Thank you, Commissioner. Board Member Gates?
I just wanted to kind of piggyback on what you had said about kind of being concerned about the income requirements with SNAP. I think that kind of just brings to light that, you know, there are people who are good people, but especially at a private veterinarian, the cost of spaying and neutering now, like when someone told me, I was like, just my brain hurt with how expensive it is. So I think being able to look at it from the perspective of like, okay, well, if this person's like a good meaning person, even if it does kind of potentially even set the cost of the shelter back, if we start looking at the forward of well, if this animal does have a litter in the meantime and the cost to care for that litter in the community, we have to like think about those potential future costs of that animal if this doesn't happen in a timely manner. So I think it's good to kind of point out that aspect of, you know, spay and neuter is kind of income transparent, if you will. I don't really know the way to word that, but I think, you know, that's something to think about as well. So yeah. I do like that this conversation came up.
Yeah, thank you. Board Member Williams?
Thank you, Mr. Chairman. I'm going to put Board Member Ward on the spot for a minute. If you've got people coming in from the county who were not able to get low-cost spay and neuter through the shelter because we were full of, all the slots were full, and they don't qualify for SNAP, as long as they're willing to pay, the county doesn't risk any exposure to the anti-donation clause if the county's veterinarian, who is now on board, were to perform those surgeries as a service in the county. It couldn't be for people, well, I don't know, the city's in the county too. I don't know how it would work out, but it might be something to look at, because the anti-donation clause just doesn't come into effect if they're paying for it.
Well, thank you, Mr. Williams and Chair. Going forward with with right now the county does provide the SNAP program where we do the rural area spay and neuters, people do have to qualify through SNAP, through that process, because that's the way the SNAP program works. Going forward with our veterinarian and into connection where we are starting with the ACEs program, we will, right now, initially, we're providing the vaccinations and microchipping. The goal is to provide the spay and neuters in those areas as well. We're looking at the free of charge. We're not looking at making anyone qualify for that going into those areas. The same thing with another veterinarian, which we are just in contract with Dr. Medina out of El Paso. We have signed a contract with for the southern border. So Dr. McKenzie will be concentrating on the northern area in certain districts, while Dr. Medina will be concentrating on the southern border, doing those spay and neuters for the county. And then SNAP will be also incorporating the rest of the county as we can, and targeting all those spay and neuters as we can. So the county's going to be hitting it on all ends, trying to combat that spay and neuter problem that we're looking at. So we are noticing that as well with the qualifying, but with Dr. McKenzie, that is something that we're not requiring people to do.
I think that's awesome. Thank you, Mr. Chairman.
Absolutely, thank you. And so maybe, like I said, it's just something, I know, like I said, there's a lot of challenges. I know that you're juggling so many things as well as Dr. Haddon, and so I'm just trying to figure out, and it was just a point that was brought up from a constituent, and so, like I said, I'm sure we'll have some continued discussion about it and figure it out, especially as Ms. Ward had talked about what we're doing in the county. I know we're trying to figure out how to get another build on the team here with the ASCMV, so. But thank you.
Yeah, thank you, Mr. Chair. We will, after your email or text, I can't remember which one it was, but your communication to me, I talked with Dr. Haddon, and we both agreed that that is something in the future that we would like to do. However, the cost of that is going to be higher than what we have now.
Yeah.
So it will be more, but if they're willing to pay, then that definitely is a possibility. So.
Yeah. So I appreciate it, and I appreciate you answering. Like I said, it just helped at least start getting that information together, and so we'll continue that. But I appreciate that, appreciate the input from the board, and give us some basis to start, or a foundation to at least start looking at some of these things. So, Thank you. Okay. I think we're done. All right, we'll move on now to agenda item 5.4, which is committee reports. We start with the finance report.
Good morning. Oh, are you going to go, Josh?
Mr.
You got this?
Seffel, good
Okay.
morning.
Good morning, Mr. Chair, members of the board. My name is Josh Saflin. On behalf of the Finance Department of the City of Las Cruces, I would like to present the unaudited financials for the quarter ended September 30th, 2024. So if we look at our first slide, that is our statement of net position. This is combining Fund 7440, which is the general fund, and 7441, which is the capital projects fund. In those funds, we have current assets, the pooled cash and investments of $2,083,642, and receivables of $2,150, giving us total assets of $2,085,792. This is offset by liabilities. We have the current liabilities of $271,008, and this leaves us with a fund balance of $1,814,784. Next is our statement of revenues, expenses, and changes in fund balance, budget to actual. This is for the general fund. Here we see total revenues for this period of $2,253,476 and total expenditures of $1,018,439, leaving us with a positive change in net position of $1,235,037. Now the revenues were at 47% of budget and the expenditures were at 21.2% of budget. Our budget parameter, this being the first quarter, was 25%. So the expenditures were slightly under, which is good, and the revenues were well over. Now taking a look at the expenses by program or function. So we're going to look at the Executive Director program. We see here total expenditures of $44,960. This is 22.2% of the budget. We see that the majority of expenditure line items were under the 25% budget parameter, except for other, and that was because of planned travel. So those travel expenses were taken up in advance, and so that's why we see that bump up in the other expenditures. Next is our medical director program. Here we see the total expenditures for the period were $242,729. This is 18.2% of the budget, and all expenditure line items were under the budget parameter of 25% for this program. Next is the kennel director. Here the total expenditures were $401,645. That was 22.8% of the budget. And again, also all line items were under the 25% budget parameter. Finally, our administrative operations, total expenditures here were $328,848, and that's at 22% of budget. Finally, looking at what makes up our expenditures, we have our total expenditures overall of $1,018,439. Of that, salary is 58% of those expenditures, benefits is 21%. Next is services at 11% of the budget, and supplies at 7%. And then we have repairs and maintenance, insurance, and other expenses, all at 1% each. And that will conclude my presentation, and I stand for any questions.
All righty, board, any questions on the financials? Councilor Corrin, you look like you're in deep thought there.
Yes, these are the pets of some of the accounting departments. So they wanted to show those off to you guys.
That's awesome. All righty. I don't appear like there are any questions, so thank you, Josh. Appreciate it. Okay, next up is... Oh, please.
I'm not sure, Ms. Bencomo sent along some additional things to add from the Financial Committee.
Okay.
If I can add those to Josh's
Absolutely,
report. A lot of it was Josh already covered, but just a few of the things that are getting updated are some of the grants and donations, including the adoption trailer, which is going to arrive hopefully soon. So I'll shorthand this as much as I possibly can. Clint's been doing some work to figure out the best way to get the adoption trailer here to sort of save money on the shipping possibilities. They're also, for the upcoming budget year, Bernice, Amy, and Clint are working on the new base method, which is the city's change in sort of how they're doing budgeting, and so that's something that the team is working on together. And I think some of those things are in progress. The strategic plan update will begin in November, but I think Clint has some ideas about salary increases and potential, sort of opportunities, especially related to the vet recruitment, which you all alluded to, vet recruitment and support, changing those in the upcoming year. So thank you for working on that and planning out some of those things in advance of the new budget cycle. And another item that came up sort of is looking at the capital projects. I think that folks are investigating, Clint and team are investigating how to get on the capital sort of ICIP for the state as an independent kind of organization. So that would be that would include potentially increasing the surgical site. That would be a substantial capital investment, and building a training and community room, or updating space to have a training and community room. So those are some of the things that are also kind of on the strategic idea list that the Finance Committee is looking at, some ways to potentially have different approaches to how we might acquire some of the money, including capital improvement through the state. So I appreciate you all looking at that, and I think that's about it for additional things from the Finance Committee from this last month. So thank you. Sorry.
Thank you, Councilor, for sharing those updates. All right. Yeah, we'll move on then to the Executive Committee report, and that'll be me. And I know when we met, there was a few topics that we talked about, obviously what was going to be potentially on this upcoming agenda. But in addition to that, I think we did talk about, and Clint, thank you for sharing some of the notes. We talked about the committees and how, I think we're working on getting everybody engaged. I think it was, in particular, one of the things that was brought up, and I think as Councilor Corn mentioned during the different committees, is talking about ICIP, how the ASCMV is working to get that plan, get in and be able to get on the list so they can try to get capital outlay from our legislators. So that's an ongoing process. One of the other items, and hopefully I'm not stepping into the Facilities Committee updates, but I think one of the things that we talked about was that Clint had been meeting with the facilities director for the city, trying to identify, there were some concerns with some of the different tasks and work orders that needed to be addressed. We talked through trying to how to prioritize and get those addressed. And so I think Clint was working on making sure we got those higher priority items addressed, and if he knew to escalate. I know he's working through updates with IT, and then one of the other items, and I know I mentioned earlier that he identified, was his meetings with bringing in the rescues and the different partner agencies into the ASCMV, and just noted that those are going pretty well. That they're being very, for the most part, I think they were very positive, so that they were a part of giving feedback, seeing what they were doing. And so it's been kind of a nice effort to really kind of bring them in and help have that dialogue active, so that, there's hopefully to prevent any, one, with the relationship standpoint, but two, so that there's not a view from the outside that that there's something untoward or not being done at the ASCMV. So I just have that area, that bit of transparency. And then the last item was talking about Clint. He had just given some updates. He's been working with the executive coach and kind of identifying some of the best practice that he's learned, some of the things he's been working with the staff on, trying to maybe get them involved and trying to get them to learn as well some of the best practices. So it was kind of a nice conversation. But otherwise, I think overall that was everything that we had noted during the meeting. So. All right. Then we'll move on to the Facilities Committee report. Mary Lou.
Thank you, Chair. Mary Lou Ward. So I'll just go over our facilities meeting. We did manage to meet a total of 3 times during this quarter. The meetings were on August the 1st, September the 5th, and October the 3rd. And during this time, I'll just point out that the new buildings 1-year warranty has expired, so that was noted during this times. And during the meetings, we addressed items that were reported and needed to be addressed, and items that reported that we're working on and that needed to be, that were completed. So I'm going to go through items that were reported, that needed to be addressed, and items that were completed. So those are the shelter door, the knob that was installed between the med wing and the RM and SB kennel room. Those were completed. The front door of the Animal Services Center that was not closing flush with the building and it was dragging through the threshold was completed. The exit sign outside of the euthanasia room in the old shelter was damaged and was hanging down by the wires, was completed. There was a sink between the office of G and H was leaking when turned off. That was corrected. The animal shelter dog intake door was very stiff and wouldn't operate. The medical wing break room water heater was not working properly. There was lock issues on the employee-only door on the medic center, and the adoption center, the building, the women's toilet was leaking, and then those were all fixed and completed. And then in addition, the Rinconada exit parking area has been painted to allow for traffic flow. And then there was dead trees in the play area, and they were cleaned up, and then river rocks were added. So those are all items that in the facility that had been addressed. They were reported, addressed, and completed. Now I'll go to the items that were reported, they were addressed, and these are items that have been started. So in the north lobby, door area, there's a lock mechanism in the lobby that won't lock. That's been addressed and reported and addressed, and it's been started. There's court keys that they're still working on with the city of Las Cruces to get those working, and there's an ASA door latch that's broken. Those have all been started. Now I'm going to go ahead and go to items that have been reported and addressed but not started yet. There's a push bar on the door to the exit exterior door to the impound lot from the euthanasia room between the kennels SA and IMK that needs to be replaced. And there's a door handle to the green dog pod that's broken. And that's all I have to report.
All right. Thank you, Ms. Ward. I appreciate the updates. All right. We've got one more agenda item under reports and presentations. That's item 5.5. It's a discussion on the upcoming fiscal year 2026 budget overview, or an overview of the 2026 budget. Sorry, excuse me.
Oh, Clint Thacker, Executive Director, Animal Service Center. Can you believe we are here to discuss budget? Seems like just yesterday I was at this very podium fumbling over budget items, but we're here to give you a very high look at what is up and coming for the budget for the 2026. First of all, the city has changed how we're going to be doing budgets. So there's a base, there's a continuous efficiency, and then additional support. Those are phases they're going to be going in. So first you enter in your base, then we look at that, then they add in some items. We look at continuous, what it's going to take for me to continue to work as the facility, and then are the asks, or in other words, the things that are going to help me do better at the center. So when we got started talking, you include all of your contracts in the base. And I said, my question was, well, we have a contract with the city and the county to house animals that come in. And if I have animals coming in, that means I need to have workers. So that's all my salaries. I need to have vaccines. I need to have medical staff to administer. So it just snowballed really quickly, and turning out what was going to be a rather large base of something they did not. So I was instructed by the budget department to assume there's no animals at the center and there's no animals coming in. And that is going to be our base for that. So our base, step one, our utilities. They said, if you don't have anything going on in the center, what's it going to cost to run? Obligations you have by the contracts, and utilities to keep it running. So we have, you see there, utilities, the insurance and premiums are included in that, as well as the contract obligations. We're talking about our copy machines, we have a business called Ecolab that comes in, they're a 2-year agreement. They come in and they do preventive maintenance on some of our items, and they also do our pest control as well. So a lot of our contracts. Then we look at our auditing and admin fees. So an audit, I have on the hook, I believe it's $15,000 every single year. There's no if, and, or buts. I have to pay that. And then the admin fees to the city for our fiscal agent is roughly around $220,000 that we provide there. So that has to be paid. So our total, you see our base there is $440,000. So on the horizon, I want you to know these are very rough estimates. I had to pull them out by tooth and nail from the budget because they didn't want to say, okay, this is how much it's going to be, because they're so far out right now. So very, very rough numbers. The city is planning, they plan on a 4% increase for staff. So I want to as well plan on a 4% increase for my staff. Now, if you remember, we decided that we wanted to keep in line because we just did our big salary adjustment. We called somebody in, we had a big survey done, and we discussed that as long as we keep up with the increases that the city and the county are doing, then we'll continue to be in line with salaries and keep them at a competitive amount. So I contacted the city or the county, and they currently do not have an amount they are increasing to. So I think on average, I think the 4% is safe to say that that's the plan. Now, the city may change. The city may say, we don't have that, let's do a 3, or so on, or let's not do any. So we'll look at that as it comes. The other issue I have is the issue between my medical director and our veterinarian. Right now, our veterinarian is starting at 98,000, I believe, but we have it hiring at around I want to say it's like 123 or 124. It's very low. You look at the amount the county started their veterinarian at, plus the amount that they have for Mr. Macias called it no, it wasn't retention, that was the wrong word. It was retention, because it was going to be a bonus. It was a retention. Yeah, and so some's paid out every so often. Individually, the veterinarian gets some. So I liked that, it was a good idea. So if I increase my veterinarian to $137,000, then that seems like a good, decent price for a veterinarian to come into Las Cruces. Problem is, my medical director would then be making less than their employee. So I had to increase the medical director, increase that to the $24,000, which is the $146,000 that you see there. So I have to increase both of those, so those are added costs. So a total salary cost increase is up to the $185,000 that you see there.
Board Member Campbell.
Joan Campbell. Clint, given our earlier discussion with Dr. Duncan, are these competitive enough salaries to attract people to come to the community?
Thank you, Board Member. Yes, the veterinarian that was hired by the county, ex officio member Ward said that they started at $140,000. So I felt the 137 was right in line with that. I'm trying to play a game, not really a game, but find the middle between the medical director and a veterinarian. In my mind, salaries are you're paying for the individual's experience and what they can bring. I don't care if my medical director makes more money than me, because we're paying the medical director to do something that I can't. I can't cut open an animal and make it not have babies anymore. So I don't mind. So for that was not a part of the question. So I'm perfectly okay with the medical director being on the same pay grade as me and making more. So we had to bump that up. And that gave me the wiggle room to do the veterinarian for that competitive amount of 137. Now, with this, that's a pretty big jump of $185,000. There are a lot of options that we haven't pursued and we could do. For instance, medical director, we could give it 1 year, we do $12,000. The next year, we do another $12,000. The veterinarian, we could do steps in there. We could, if we needed to, we could decrease some of the asks this year, as long as we make up for it next year. But there's just so many possibilities that we could do to make these work. I just don't want the board to feel like, holy cow, he's going to ask for $200,000 in salaries alone. But we'll look at it when we get there. I just want to give a heads up that those increases are coming. Some of our future items that we have. In our strategic plan, we're excited to be starting. It's going to be starting in November. I'll have something I want to go one-on-one coming in December with our board, so they can give feedback. With that feedback we get in December, we'll do changes if needed, and then we'll present the strategic plan to the board in our January meeting. That's kind of the timeline we're looking at right now. However, with a strategic plan, might be some shifting in our focuses. So if our mission, we change, for instance, to provide spay and neutering for the public at a average cost or a decent cost. If we were to go that route, that is not in my mission currently. Our mission now is to provide a safe and a safe place for animals to be until they can be redeemed or adopted. So that's my mission, and that's what we go strive for. But if we go the route to change it and provide that sterilization for them, I'm going to need that funding for that. So you'll see that coming up. And then, like I said, we'll present in January. We do have some capital goals that we'd like to see, and these are approximate numbers. The surgical site, or the surgical suite right now is back in the back of the center. I think some of you have been there, you've seen the small area. Our hopes is to bring it up into the medical center, into the middle where the adoptable cats used to be. There's a VIP room. We want to knock out a wall, have the cages there. We've already purchased 2 tables. Dr. Haddon's doing an excellent job of every year just kind of purchasing a little bit at a time to move into that area. We estimated around $500,000 to move that, to build it out to what we need and what we have in that area. So that's upcoming as well. And then our community education center, we don't have a place to meet as staff. Right now we meet in the lobby. There's people knocking on the doors all the time during staff meetings. It's not a very presentable place to be able to have the staff focus. We have no place for the community to come and discuss issues and problems. We have to take a desk or an office and kick the person out. It's just nice to be able to have those capabilities. Also, no place for the community to come and do things. We have a group of volunteers that come. There's no space for them to work other than outside or in the main lobby. So a community education center we're asking for. When I speak to the facility or the department that helped us build the center, they're talking around a $550 to $600 new construction per square foot amount. So when we look at how much, or at 2,200 square feet, it was about a little over $1 million, as you see there, to build for new construction. The reason why it's so much, I'm like, it can't cost $1 million just to build a box with a cement floor. And the reason it's more is because whenever you add square footage space, that means you also have to add restrooms into them. And you have to have as much as space, square feet that you had, that's people occupying space, which means you have to have restrooms. And those can get expensive fairly quickly. So that is one of the main driving costs there. The 1.1 million does include furniture, tables, chairs, and TV, everything that you need in an education area. So how we go about getting these things, I can't just ask the city and the county for that much money. We may be getting it, but we need to start saving. And we need to start utilizing other things like the ICIP, the Capital Improvement Plan, through the legislature. So I've had some great conversations with board member Patrick Peck, being able to help me go through the wild and craziness of lobbyists. He has a name for me to reach out. We can get that in the next board or in the next budget meeting and discuss them. He says it's just impossible to navigate it without a lobbyist. You have to have someone there that can talk for you and to work for you, let you know of things that are happening. And he says, and you have to be there as well. You have to go and visit and talk and shake hands. So that's something we'll be doing again next year as well. But Fund 7441, I spoke with accounting. Josh has been a huge help with me as he's answering some very simple questions. And we'll be able to, with the funds left over each year, we can say, okay, let's put a percentage of these into this capital fund and hold on to them, and it can just be left there and continue to grow every single year. Are there any questions? Pretty high level stuff, I know, but I wanted to show you some things that are coming up.
All right. Board members, any questions? Councilor?
I just want to sort of speak to some of the history that maybe I think is part of this too, and I really appreciate you thinking these things forward and considering all the implications. Just in the context of what the shelter does, even in the last year, you guys did present a budget increase that would have increased capacity for a lot of surgeries that I think that we didn't take up. a city or a county, I think. And that was just not staff related, but really space related and maximizing space. So I think, sort of we have to consider all of the competing priorities. But even going back a little bit further to the history of when the shelter did provide a lot of spay and neuters for the public, a lot of things have changed in that time. So I would add things like the very robust TNR program that you all have been pretty integral in implementing. Didn't exist in the past when the shelter provided public spay and neuters. So like the capacity issue, without resolving the capacity issue, as you mentioned, Clint, changing the mission would change some of the functions of the shelter and some of the dynamics of how intake goes and what we're able to do in terms of capacity. And so I just really appreciate you thinking about that and also considering, how those things might change and how it might affect some of the things that we've implemented that I think have been pretty successful. I would say the TNR program, now that it's sort of gotten off the ground, has really taken hold and is making a fair difference in a lot of areas. So I think I want us to have a really thoughtful conversation about what it means and what it means to have limited resources, what it means to expand those resources, and how we do that in a timeline that doesn't mean that we're sort of leaving behind certain parts of the mission versus others. And so I think what I would really appreciate too as the next iteration of this is seeing, and I think that's what you allude to in the conversations that we'll be having, but really what does this look like in 1 year, in 3 years, in 5 years? If certain budget scenarios happen, what would that look like for us? And I think that those conversations, we've sort of alluded to them a lot of times here, but I don't know that we've really had them collectively. And so I think that will be a really good opportunity to do so in the next few months that you mentioned. So I just sort of want to speak to the full process, and I think I really appreciate you bringing this up. I think in the past we've been talking about this in January 1st, and so this is a real, I really appreciate you being here in October so that we're all thinking about it, it's on our radar, and I really appreciate you planning out some of these scenarios and looking at what the opportunities are. And so that's it. I just wanted to appreciate that, and I look forward to the future conversations and just the context for where we are in the history. And I sort of want to hold us all accountable to the fact that we have to go back to our constituencies or our respective boards and ask or advocate for the money that comes with these things, that may come with these things. And I think we should hold ourselves accountable to that. If we sort of, I say this, I will hold myself accountable to this conversation as we go forward in the budgeting process and what it means, changing the mission, expanding funding, and how do we consider that in the priorities of all the other things that we're doing as city and county government officials. And so I think that's the context that we have to consider and really be thoughtful about too. So I appreciate you putting all of that out here, and I just wanted to add that to sort of all of us to think about as the context as well. So
Thank you.
Thank you again for this presentation.
Thank you. Next, Mr. Member Ward. Yes.
Thank you, Chair. I just wanted to make a comment on the veterinary position. I know it's important for the shelter to get that position filled, as we are short veterinarians in this community, in this state, as we are globally. But looking at the position and making comparisons in regards to what we have throughout this, I think it's really it's important for the board to understand that we probably should not compare the shelter's veterinarian as we do to a family practice veterinarian, as we would to even our veterinarian, because those goals and duties and responsibilities are totally different as they are for my family practice as they would in a shelter. So you are looking at tremendous different responsibilities and hours and totally responsibilities and tasks as a whole. That's it. Thank you.
Thank you very much. Okay, any other comments, questions? Okay. All righty. Then we'll move on to discussion items, which is 6.1. Discuss possibility of adding a planning and policy committee to the ASCMV bylaws.
Thank you, Clint Thacker, Executive Director. Kind of a continuation of my slide here. I sent out a discussion to the Executive Committee regarding the idea of including or adding to our regular committees. We have a Planning and Policy Committee. The reason is behind this. When I submit information to the board, there are times when it takes a little while to get information back. I totally understand it, especially elected officials, very busy. But I'm wondering if there isn't a way through a committee we can get a small select individuals instead of sending out to everybody. I can get feedback more efficiently from policies and things that I want to change. And then we can have a buy-in on that from the committee. And then I can present to the executive committee when I talk to them on a monthly basis. And then I feel more comfortable when I come to the board and say, these are some things we'd like to change. The biggest item that I can see right now is the bylaws. I have bylaws that need to be changed. I've reviewed them. I have recommended changes, submitted them to some individuals on the board. And the feedback is just so that I need more to be able to feel comfortable presenting to the board on that. So you see here on what the policy committee would be doing. It also would be keeping up to date on the strategic plan, that they could keep my feet to the fire, the director's feet to the fire per se, of keeping those things going. And also the strategic plan is going to be a living document, so I'll be able to coordinate those changes with them. There's some ways we can go about doing this, 2 of them, if you decide to. You can, in the bylaws, it states that you can, anytime, the board can create a special committee. Pretty much all you do is say, we want to do a special committee. You can add to the committees that are there. The other one that you can do, which is different, is called an advisory committee. You can have individuals from the public on it. You can have individuals from the ASCMV, from the board. And it's an excellent way to be able to get different, we can get a policy pro on there. We could get some individual that has specialty in maybe strategic planning on the board or on that advisory committee. And yet the board still has control over it, so you specify specifically what it is you want them to do. So I open up to discussion. If you want to talk, those are some ways that if we want to move forward, we can, or we can just wait until we update the bylaws and create the committee then, if that's something you want to do as well. Have it part of the 4 or the 3, add 1 on there for the 4 committees, so.
Board Member Gates, yes?
So I definitely am in favor of having a more especially in the context, I think, of strategic planning. But I think that where my brain goes with this is we really need to have a way to distinguish the description of this committee from what the executive committee is supposed to be doing. So I just want to make sure that whatever these responsibilities are, either if they end up kind of taking some things away from the executive committee, but I know that broadly the description of the executive committee should kind of cover these things. Technically, doesn't mean that it necessarily should be their responsibility. I think especially in the context of strategic planning, I think that that's something that I personally would love to see as a more of an open ad hoc committee, because I think having community members involved in that process beyond just the ones on the board, I think would be amazing. And I know that that would also mean that those meetings would be public, I believe, depending, again, I think all these little nuanced things with regard to the way the committee is created can be determined by the board, but just kind of some things to think about with regard to just making sure that there is a clear distinction between what the executive committee is responsible for and what this new ad hoc or special committee, advisory committee, et cetera, is responsible for.
If I could, board member, thank you very much, Board Member Gates. Yes, so the advisory committee does fall under Robert's rules. So there will have to be those things done. However, the special committees do not, according to our bylaws. So that's one thing I forgot to mention. Thank you.
Sorry, go ahead, Councilor Corn. I started.
No, I was just
Thank
going to
you.
say, I was going to suggest that I think that there is a lot of nuance, as Board Member Gates mentioned. I think I would recommend that we create an ad hoc bylaws committee and constitute that committee thoughtfully. I think special committees are within our purview, and that would be what I would suggest, the path that we do, and then that group considers it. Because I would say, I mean, there are some things that I can say conclusively. The executive committee does not have it's not enough people to do a lot of these things, and it has other things that it sort of maintains. So I would say, definitely there is a space for a different thing, but I don't know exactly what that would look like if we want to put something into as formal committees, or keeping space for advisory committees and outlining what those advisory committees might look like. I think we have to update the bylaws anyway, because we've changed the JPA and the MOU already, so they're already pretty out of date, I think. So I think we have to get on the bylaw discussion sooner, and I would like to recommend that and this isn't an action item, I think it would have to go to the next meeting to be an action item, but I would recommend that we as a board designate a bylaw committee and just sort of think about what that might look like, that's slightly more nimble than the full board, but less narrow than the executive committee, and then they work specifically to generate the answers to these questions. And so that would be my sort of procedural recommendation, just to make sure that we get the voices and sort of make sure that we're doing this in the appropriate way. So,
Great. Thank you, Councilor Corn. Board Member Campbell, and then we'll go to Commissioner
I
Sheldon
echo
on
the
this.
idea of having a policy or a bylaws committee. I think this is one of those things where form follows function. And if we get the bylaws all considered and tightened up, everything else will flow out of that, whatever committees we need or advisory committees and so forth. So I would echo that.
The Commissioner, yes, please.
It's kind of along the same lines, but also what I would really recommend would be set up that policy kind of committee from this board, but use the power of contracts to contract a company that specializes in this. That policy board or that policy committee can give kind of guidelines and or direction on what that's supposed to look like, but I would definitely look from outside this board for doing something that's that big. Learn from best practices from other animal services in different communities, compile something, have them present to us at a board meeting in 2025, but I would definitely use the power of contracts and go out and kind of put out an RFP to find someone that can do this work, and that policy committee or that policy board can kind of give direction and be that main point of contact. But if it's as heavy of a lift as you're presenting it as being, and the fact that we haven't tackled it yet, I would probably look from outside this board to do something like that and have it report to the committee that we could stand up, which would also have to be an amendment to our bylaws to put that committee into effect. So I would definitely look outside.
Thank you, Commissioner. Any other comments? And I really appreciate all of them, and especially Councilor Corn. I think you were spot on with where this would be with the executive committee. I think we do need to possibly look at it at having an ad hoc committee. I think having that having a special committee to be able to do this would help actively. They can meet, they can work on bringing larger recommendations, whether we do go out and bring someone in for the outside to kind of help give us suggestions on where we could go. I think it'd be interesting to see, but I think I would agree that I think it would help us to create a committee to be able to bring those to the board and be able to work on that actively between the meetings, so that way we can have that. And I don't think at all it will I don't think it'll overlap with the executive committee, aside from maybe giving just an update on where we stand. But I would be in support of a separate committee. So, okay.
Excellent. Thank you all very much.
All right. All right, then we're on to, under section 7 of our agenda, 7.1. It's a resolution, resolution 2024-06. It's to authorize the Animal Services Center of the Mesilla Valley to piggyback with the County of Greenville, South Carolina, contract 22-125 with Patterson Veterinary Supply Incorporated for the purchase of animal pharmaceuticals and supplies in the amount not to exceed $200,000 through the end of the fiscal year, which is June 30th, 2025, and $250,000 annually for one optional additional one-year renewal term, subject to appropriations and renewal. If I get a motion.
Move to approve, Graham.
Oh, second, Sheldon Hernandez.
Okay, we have a motion by Vice Chair Graham, second by Commissioner Sheldon Hernandez. Take it away, Clint.
Thank you. I don't have a PowerPoint for this, but it was just open for discussion. So we had a plan a little while ago, if you remember, and it was, I think it was through the city of San Antonio, and then they dropped theirs, so we had to find somewhere else. This is incredibly needed. We're already at the $25,000 max to spend, so we do need this, that we can continue forward. And this is for the veterinarian vaccines for the animals at the ASCMV. Just to give you a record, if this does pass, we're in such short need that Bernice is going to go directly and get it recorded. And so we can draw this up and start doing this immediately.
All right. Are there any questions, comments, public input? All right, not hearing or seeing any, then we'll do a roll call vote. Ex officio member Ward?
Yes.
Commissioner Sheldon Hernandez?
Yes.
Board member Gates?
Yes.
Vice Chair Graham?
Yes.
Counselor Corn?
Yes.
Board member Campbell?
Yes.
Board member Williams?
Yes.
And Chairman Sanchez, Commissioner Sanchez, I vote yes, and so with that, it's a unanimous yes, and so Resolution 2024-06 is approved. All right, then we'll move on to the second item under approvals. It's Resolution 2024-07. It's a resolution allowing for a carryover of remaining grant funds from fiscal year 2024 in the amount of $136,154.38 from various grants for revenues and expenditures in Fund 7440 and to adjust the adopted ASCMV fiscal year 2025 budget. If I can get a motion and a second, please.
Move to approve, Corin.
Second.
Sorry, the second was from Board Member Campbell?
Second, yeah.
Okay, perfect. All right. Clint?
Thank you very much. This one is, we're excited for this one. So the reason why this money is such a high amount, $136,000, if you remember in April, we accepted a $110,000 grant to purchase the adoption trailer. So that money plus the $26,000 from our remaining grants needs to be brought over. $23,000 of that 26 is set aside for the tops of our kennels that we're going to be purchasing. So it's all through grants. We're excited to move forward. And like I said, the grant for the trailer, hopefully we have a pickup date of November 3rd. So it's right around the corner.
All right. Are there any questions on Resolution 2024-07? All right. None hearing any, so I will do a roll call vote. Ex officio member Ward? Oh, I'm sorry. Oh, public input. Sorry, are there any members of the public for input? All right, not hearing or seeing any. All right. Then we'll move forward with a roll call vote. Ex officio member Ward?
Yes.
Commissioner Sheldon Hernandez?
Yes.
Board member Gates?
Yes.
Vice Chair Graham?
Yes.
Counselor Corn?
Yes.
Board member Campbell?
Yes.
Board member Williams?
Yes.
And I, the Chairman Sanchez, I vote yes. And with that, Resolution 2024-07 is approved. Thank you all for that. Now we're on under agenda item number 8, Section 8, which is under public input. Are there any members of the public that are here for, like to give input? Yes, please, go ahead and step up.
Good morning. My name's Tina Dalcor, and I would like to address, oh, okay. I forget I'm not short. One of the things that I have, I want to thank the shelter for having the free microchips for the month of September on Tuesday. I was kind of disappointed at how many didn't show up, but at least 100 animals did get microchipped. Then when they had their clinic, which Clint didn't talk about, they had over 200 people show up for microchips. I paid for, or not actually me, my son paid for 100 of them. And we hope to have a program going for all of next year that we will be finding $15,000 to microchip 1,500 animals, which will, once again, one of the statistics that they didn't show is how come they had to take all those animals to the shelter? Because they had no microchip. So they can't return the animal to a home. The same thing for Clint with the people that surrender, or that, not actually the surrender, the strays. All of those strays do not have a microchip. So what do you do with it? You have to take care of it. And I really like your idea, Clint, of not having any animals at all at that shelter. That would be the ideal dream. And only the injured and sick ones will show up. But it's a really sad thing that all of those animals technically didn't belong to nobody. So for a $15,000 investment next year, which I hope with the person that I have that's going to be helping me with fundraising, we can get those animals microchipped. It lessens the job of animal control. It lessens the burden on animal services. And one thing that everybody talks about, it will lower the euthanasia list because there won't be any animals to euthanize. They will all be home somewhere. We talk about the kittens and puppies. That's another problem. But most of the animals that I see coming into animal services are over the age of 5 months old. And they had a home for those 5 months, or 5 years, or 10 years. Right now I'm helping a client who adopted an animal out of animal services, who has heartworm. The veterinarian bill on that is $2,000. Well, actually more. I'm contributing. They're getting a SNAP voucher, and we're not sure where the other $1,000 is coming from. But at least we have an agreement that we know that this dog will die from heartworm because there is no option. And it spent a whole year at animal services. And that's when the disease progressed to the point that we need to make 3 treatments rather than the 1. And it was 3 years old when it arrived. So for 3 years, somebody took care of it. But then for whatever reason, it ended up at Animal Services, spent a year there, and hopefully, it will spend many more years at this new family. So if you're willing to put some money somewhere, please attend one of the fundraisers and contribute, because I want every single animal in this county and city to be microchipped. It is part of the ordinance. It's something that animal control can easily enforce. All they have to do is take their scanner. You don't have a microchip. And get that microchip put in that animal. And it's only a $10 investment. So I hope that next meeting, I can give every one of you board members a Zen Pet sticker, because that means you have your animal microchipped, vaccinated, and fixed. And then I'll be giving money to animal services and to animal control or rewards, so that when they see somebody that has an animal that's a Zen Pet, they get an incentive for having their animal totally legal. So once again, it's a part of the community, and why people don't want to make that $10 investment, they buy beautiful collars for the dogs, but there's no tag on it. You can write with a permanent marker on the inside the animal's telephone number. None of those have been done. And why the community doesn't do that, but they're screaming because there's so many puppies and kittens and so many euthanasias done. And the simple solution is a microchip, which doesn't have to be done by a veterinarian. And then I am asking all rescues in this county to do a update, because they are capable of updating an animal's information. Once again, I take mine. When I find animals, I go to Animal Services. They check the number, call the people up, and I wait there until the family comes gets it. If it doesn't have a microchip, which is 80% of the time, it has to be turned into them. And that puts a burden. So let's hope that Clint's idea that there is no animals at Animal Services, a dream that most likely will never come true, but that's the goal we should have, is 0 animals at Animal Services. Thank you.
Thank you, Ms. Dalcour.
I just wanted to say, Tina, thank you again. I know you're every day, every year committing to doing a whole bunch of things for animals in our community, but definitely when you come up with your fundraising thing, please let me know personally. I will work on getting a challenge in there to help
Hopefully
donating money.
The person that was going to do the next fundraiser for the next $1,000 worth, they had a little glitch because they're a club at NMSU, so she had to open up a personal bank account so they could take money into it. But hopefully, I'll get her on board, and as soon as she gets everything finalized, we'll be doing that.
Okay. Please definitely
But every month,
let us
we're
know.
going to have a fundraiser from somebody, somewhere, somehow, because my goal is to get $15,000 by next year and
Okay.
have those animals microchipped for free.
Let us know when and how we can support you.
All right,
Thank
thank
you, Tina.
you.
Are there any other members of the public who would like to offer comment? Seeing none, moving on to item number 9. Are there any chair or board comments? Councilor Corrin?
Board member Ward 2. Sorry.
Thank
Okay.
you, Vice Chair. I just have a comment. I just would like to make a comment in regards to the Mesilla Valley Regional Dispatch Authority has reported that they're having technical issues with the non-emergency number. That's going to be the 575-526-0795. So if you are reporting an issue there, you might have some technical issues getting through to that number. So if you do, if you'll bear with them, and these are the numbers that you can call in regards to that. So you can call 575-805-7852 or 575-805-7853. Those are the numbers to call if you're having trouble with the regular non-emergency number to get through to that. Please don't call 911 unless it's an actual true emergency. That's all I have. Thank you.
Thank you so much. Councilor Corrin?
Thank you. I just wanted to give a quick update. The city of Las Cruces is first year contributing to the Spay and Neuter Action Program, as the county has been doing for years and years. It's happening. I anticipate that the contract will be finalized, which is apparently a very cumbersome process, by the end of this year. And so the city residents will have increased access to spay and neuter surgeries through SNAP for the first time, I think. And I hope that's an investment that we can keep considering going forward. But I just wanted to give a quick report on some city activity in that area. Thank you.
Thank you so much. Any other comments? Okay, then at this time, I'll entertain a motion to adjourn.
So moved, Shalja Hernandez.
Seconded, Corin.
Thank you so much. And I'll do a quick roll call. Ex officio member Ward,
Yes.
Commissioner Shaljo Hernandez,
Yes.
Board Member Gates,
Yes.
Counselor Corrin,
Yes.
Board Member Campbell,
Yes.
Board Member Williams,
Yes.
and Vice Chair Graham votes yes, and we are adjourned at 11:35 a.m. Thank you so much.